Administration of IV fluid therapy. When you're getting ready to start an IV, you need to verify the appropriateness of the fluid. Check the type and the volume of the fluid because it needs to correspond with the physician's order. Check any medications that are contained in the fluid. Again, the medication should also correspond with the physician's order. Look at the expiration date of the fluid. Evaluate the integrity of the fluid container. If it's a glass container, which you don't see too many of those these days, you do need to make sure that it's free of chips or cracks. And a plastic container has to be free of punctures, and the cap of either one has to be undamaged. Inspect the fluid for clarity and the absence of any particulate matter. With the administration set tubing, it has to be appropriate for the ordered therapy. The drop factor has to be appropriate. And again, you need to determine the integrity of the packaging. It should be sterile when you open it. Supplies for establishing the IV site. You need to make sure you get the cannulas. You have to have the appropriate gauge for delivery of the ordered therapy and the age of the patient. For example, if you have a patient that has come in with a hemoglobin of 8.2, you can suspect that it would be very probable that you would be administering blood products. And with blood products, it's necessary that you use a catheter that is at least a 20 gauge, if not larger. An 18 or a 16 is preferable. If you get smaller than that, then it can actually destroy the red blood cells as it's infusing. You need to also have more than one cannula available to use in case venipuncture requires more than one attempt. But there should be no more than 2 IV attempts by any one nurse. You need to make sure that you have the appropriate antiseptic for cleansing the skin, and the type will depend on the facility's protocol. You need to have tape. You need to have the IV site dressing, and again, the type will depend on the facility's protocol. It may be a 2x2 gauze, and it may be a transparent semi-permeable membrane. You also need a tourniquet and protective gloves. And lastly, you need labels. You need a label for the administration set. So you place a label on the tubing to indicate when the tubing should be changed. You also need a fluid container time strip that can be done with a strip of tape, and a label for the IV site itself. Infusion equipment with the tourniquets. Make sure that you assess the patient for latex allergies. Most medical products these days are made without latex, but there's still a few of them around. But if you do have a latex allergy, then make sure you're using latex-free products. The tourniquet is usually applied above the appropriate selected venipuncture site, and you usually apply it within a few inches of the site that you're looking to use. If you're looking to do a venipuncture in a hand, then it's not recommended that you place the tourniquet above the elbow. You would actually place it, say, mid-forearm. And an arterial pulse should be easily palpated distal to the tourniquet site if it's not too tight. When you attach the administration set to the fluid container, you always need to wash your hands before beginning the procedure. Squeeze the drip chamber when you insert it into the fluid container, and then you displace the air from the administration set by opening the roller clamp slightly and inverting and tapping any Y injection ports. The tubing label should indicate when it should be changed, again as established by facility policy, And the fluid container label should identify the fluid and any medications added, plus whatever the facility policy dictates. Usually it will have the patient's name and or room number, the physician, possibly account numbers. It may also indicate the rate that the fluid is to infuse at. And those are just examples. Make sure that when doing fluid therapy that you identify the patient appropriately. Confirm your order. When you're identifying the patient, you need to use two means of identification, usually asking them to state their name and or checking their name on the identification bracelet. With patient interaction, ask visitors to leave during a procedure, but you can also ask the patient if the visitors should step out of the room. Sometimes the patients like the visitors to stay. It's a comfort measure. Draw a curtain if the patient is in a semi-private room. Make sure that you question their allergy history, asking specifically about iodine and latex. We use iodine frequently when we're cleansing the site for insertion. And again, there are still some latex products out there. Explain the procedure that's to be performed using understandable terms, in other words, layman terms, terms that the patient will be able to follow. Address concerns that are voiced by the patients in a truthful and factual manner. Explain restrictions that are necessitated by ordered therapy. If they are going to be tied to a continuous IV line, then they need to be very careful with the IV site, the IV tubing, and if they're getting out of bed to ambulate or to go to the restroom, then they may require some assistance with the IV pump itself. If the patient is to be ambulatory, again, demonstrate positioning of the IV site extremity during ambulation. How should they walk? Where should their arm be? How, etc., etc., etc. And assess the patient for IV site suitability. Ask the patient where they prefer the IV to be started, and select the most appropriate site for the patient and the solution to be infused. If you're going to be infusing high volumes of fluid, you're not going to want to use a smaller vein. You're going to want a larger vein, so it will accommodate the amount of fluid that you're infusing. Make sure that you tailor everything to the patient.